Opiates. It's scary to think that how breaking your leg can lead to a life of addiction and or death. Opiates, whether found in the form of a prescription from your doctor or in the form of black tar heroin from a drug dealer on the streets, will take many forms, or will take many people on a ride through a life full of addiction and turmoil, possibly ending in death. To understand what I am talking about, I will first examine how most people are being hooked and swallowed into the perilous opiate lifestyle. I will then look at the death tolls from overdoses to opiates. I will also be discussing what is being done to combat the opiate overdose epidemic through means of politics, police agencies, first responders, family, and friends, along with the National Institutes of Health and the Health and Human Services. Lastly, I will discuss whether the opiate crisis has improved or not as a result of the various combat efforts. Hooked and swallowed into the perilous opiate lifestyle. How people tend to get hooked in the first place. Many people can be hooked on opiates at any age, whether it be from wanting to try something new at a party or a simple visit to the doctor. For a visit to the ER for a broken bone can lead a person leaving the hospital with a prescription to a life of addiction and or death. In fact, according to an article, the opioid overdose crisis found on a NHI website updated 2019 explained that roughly 21 to 29% of patients prescribed opioids for chronic pain misuse them, and about 80% of people who use heroin first misuse prescription opioids. No wonder we are seeing a spike in opioid overdoses, which brings me to my next point. A major increase in overdose and overdose deaths from opiates. People of all ages are being hooked on opiates and dying left and right. I will look at how many people have died from opioid drug overdoses in 2017 alone. And according to an article on a website for the CDC, the Center for Disease and Control and Prevention, updated December 18, 2018, opioids were involved in 47,600 overdose deaths in 2017. In comparison, about 58,000 U.S. soldiers died in the entire Vietnam War. So let's make no mistake about it. This is a battle, if not a war, for many Americans lost in the world of opiates. It's time to fight back. To combat the opiate epidemic, the Trump administration has taken a stance on the opiate crisis. According to an article in CNN Politics put out by Megan Vasquez on April 24, 2019, the CDC has shown an overall 3.2% decline in overdose deaths from September 2017 through September 2018. Whereas the same article, the Trump administration has called the initial numbers a victory stemming from White House-led efforts to combat the crisis, such as the creation of a commission to provide recommendations to the federal government, the declaration of a national public emergency, and the signing of a sweeping opioids package into law. Another successful tactic to curbing overdose fatalities has been made in part by the drug called naloxone. For according to the NIH, many law enforcement agencies, first responders, and even family and friends use drugs called naloxone and Narcan to help reverse the effects of someone who is overdosing on opiates, which in turn is helping to save many lives. Let's now look at the U.S. Health and Human Services and National Institutes of Health are doing to combat the crisis. According to the article Opioid Overdose Crisis on an NIH website revised in January 2019, the Human and Health Services is focusing its efforts in improving access to treatment and recovery services, promoting use of overdose reversing drugs, strengthening our understanding of the epidemic through better public health surveillance, providing support for cutting-edge research on pain and addiction, and advancing better practices for pain management. In the same article, it was said that NIH met the pharmaceutical companies and academic research centers to discuss the safe, effective, and non-addictive strategies to manage chronic pain, as well as new innovative medications and technologies to treat opioid use disorders and improve overdose prevention and reversal interventions to save lives and support recovery. So since some of these changes were implemented, have things really improved, or is this just a slight pause in the epidemic? Well, as stated before in the above CNN article, the CDC has seen an overall 3.2% decline in overdose deaths. I also found an article called Stat, written by Andrew Joseph on October 23, 2018, stating that according to the CDC, in a 12-month period ending in March 2018, that there is a decline of 2.8% in the number of overdose deaths compared with the 12 months ending in September 2017. Now those numbers are no joke. That's a few thousand lives that are accounted for and still here. With that said, until more data intel comes our way, we will never know if the number of lives being saved are still continuing to rise or steadily falling. Also, we will need more time when more data comes to figure out what else needs improving. In conclusion, it can be very easy to get hooked on opiates, including with just a simple prescription from your doctor. Thousands upon thousands of people are dying from opioid overdoses every year, but thanks to new efforts on behalf of the Trump administration, along with first responders, family, and friends, many lives are being saved with the help of the drug naloxone as well. For we are seeing a decrease in lives lost, but we can't know for sure if this is the real deal or just a slight pause until further data intel comes our way. Whether it be through better alternatives for medical prescriptions to pain management or stricter laws to combat the crisis in the streets. It's time we all work as a society to save lives. And that is my speech about opioid overdose. I hope the audience took from this that opioids can be very dangerous and you want to be careful. Loved ones and many people are dying. And thank you for listening. This is my audience that I had here. If you guys want to, right here was my audience. We got them right there. And we got them right there too. All right. Thank you so much for listening, and we hope you enjoyed.